Okay, we're now in part 6 of this online program from Radcliffe Cardiology. We're looking at PoTS, an increasingly diagnosed problem in a group of patients who really are frequently desperate when they're looking for a diagnosis and they're looking for treatment. We've talked in the first 5 sections about diagnosis and subtypes, comorbidities that are associated with PoTS, the non-pharmacological management and the pharmacological management. And what's striking from the session so far is that there's certainly a need for more data and for more treatment options. So, Dr. Nick Gall, I'd like to hand over to you. We're looking for the future. We're hoping for better treatments and better data. So take it away.
Thank you very much. So yes, I've been asked to talk about the future. So in approaching this section, I thought that I'd look at PubMed and publications. And so this is a graph of the number of publications where postural tachycardia syndrome is part of the search characteristics. And there's an article that was recently published discussing postural tachycardia, mast cell, EDS, which refers to an explosion of research on the etiology of PoTS. So as you can see, there is a significant increase in the number of papers that we've seen relating to PoTS. Interestingly, of course, we've heard that PoTS occurs perhaps in 1 in 500 patients, which is very similar to the incidence of hypertrophic cardiomyopathy. And you can see on this graph how the number of papers on hypertrophic cardiomyopathy absolutely dwarfs the number of publications on PoTS. And then if we throw in one of the major cardiological epidemics, atrial fibrillation, we can really see that while there has been an increase in the number of publications on PoTS, it is in fact a very tiny number, particularly considering the number of patients who are out there. So there's a certain amount to go on. What studies are going on? So I looked at clinicaltrials.gov to look into the number of trials that are currently listed in PoTS, and you can see that I found 69 currently listed. You compare that to AF, there's 2,500, and hypertrophic cardiomyopathy, 172. But then it is a busy slide, but essentially you can see highlighted in bold that actually where it comes to proper chronic studies looking at lifestyle management to prove that all of the lifestyle management makes a difference, or that chronic drug therapy makes the difference, that there are in fact very small number of trials. So unfortunately, while there is some research going on, and of course not all research studies are listed, there is very little out there. So what do we need for the future? Well, there has been progress. We recognize now that the condition exists. Too many times we've been told that postural tachycardia syndrome is not a real condition. It's a psychological condition. It's a condition that certain cardiologists make up. However, there are international guidelines, and Professor Lobo has shown details from the Heart Rhythm Society. The Canadian Cardiac Society recently published, and we are in the process of putting together a working group to develop a UK guideline. So there are guidelines to validate the condition and what we do. We are better at educating colleagues. Obviously, there is this webinar. There are regular conferences. There are yearly conferences in Syncope, and there's a 2-yearly conference that we run on PoTS. There is a forthcoming textbook out in October where many colleagues have written in detail about the management of PoTS and related conditions. So there is better education. Certainly the progress has been made because charities, the media, social media have allowed patients who, as we've heard, may take 7 years to receive a diagnosis. They can hear about the possibility of this condition well before that 7 years is up. So progress has been made. However, more is needed. So we don't understand the underlying cause. There may be many causes, as we've heard. We need more research into the underlying causes. We're starting to recognise, as I mentioned earlier, that a small fibre neuropathy may be relevant. So investigating really what may be causing this, so that rather than a syndrome, we can focus on, in fact, what the diseases are. There are very few clinical services. So we have a centre at King's. Professor Lobo runs his centre at Barts. We have colleagues at Queen Square. We have colleagues in Sheffield. There are smaller clinics around the country, but in comparison to the number of patients, there are very few centres. This condition is viewed as frequent enough that every local CCG, every local health system should run their own PoTS clinic, but that just doesn't happen. And so improving clinical services is going to be vital because our waiting lists are just too prolonged. And also we've heard how important multidisciplinary working is. So those clinical services need to be driven and improved. And as we've discussed, we need better research. We need more research. And in fact, frankly, we need some research. We need to be able to characterize the patients. We need to say, actually, they all do come with the same bladder problem, or they all do have migraines, and that needs to be written down so that people understand. There has been a focus on the heart rate being everything. As Leslie suggested at the beginning, the definition requiring 30 beats per minute was a purely statistical one. So we need to understand not just that it is a heart rate problem, but what actually is the underlying issue. And clearly, as I pointed out at the start, we have very little evidence base for deciding medications. All of the medications we've discussed, all of the interventions we've discussed are very experiential. So we have experience with those. We understand how they work. We understand how to prescribe them. But that is not necessarily something that is backed up by evidence, and we require that. So it's great that we recognise this condition. It's great that we're getting so many referrals now, but there is so much more work to do. Thank you very much.
Thanks, Nick. So in terms of funding sources, imagine that you, Professor Kavi, Professor Lobo, wanted to do a trial into an intervention in PoTS. Where can you go for funding for a study like that?
I think that's difficult. I think because there is a background in cardiovascular symptomatology, because a lot of this is perhaps vascular dysfunction. Then certainly I'm aware that the British Heart Foundation has supported research. So I think cardiovascular funding bodies, cardiovascular charities will support the area. As I've said, we may find that the small fibre neuropathy is relevant, and it may well be that from the neurological side that there is funding. So, we may find that a proportion of these patients in fact have a cardiovascular manifestation of a neurological condition. So it's about, again, multidisciplinary working with our neurology colleagues to look for educational sources, look for research sources in all forms and in all charities to see if we can make the difference.
And you've just shown a slide there that there are far fewer studies being done. So, Leslie, is your feel that there just aren't as many investigators interested in this, or that they can't get funding for studies? What is it that's led PoTS to be slightly lagging behind in terms of large data collection to date?
I think, first of all, as Nick said, there's just very few centres in the UK. So there's just a very small number of people at the moment who are actually interested and willing to undertake that research. I think another problem is that it falls a lot between specialities. Again, as Nick said, between cardiology, neurology, then there's rheumatology, there's endocrinology, there's lots of different people involved, and it's about linking these people up together so that they can all work together to apply for these grants and hopefully get us a little bit more knowledge about PoTS.
And tell us a little bit about PoTS UK. You're involved in that charity. What does it do? What support can it offer?
So first of all, it's about 10 years old now, and we have a website with quite a lot of information on it, and we also have some social media channels. We aim to support both patients and healthcare professionals. We've got about 13,000 followers, I think, in social media. And in terms of healthcare professionals, we have a section which has videos and slides and lists of relevant papers to help educate healthcare professionals more. We also, as Nick mentioned, we run a 2-yearly masterclass where we bring in specialists from around the UK and around the world and get them to share knowledge. And we also use that as an opportunity for people to network so that they can think about issues like research, for example.
Yeah. And Nick, you mentioned this book coming out, a fairly comprehensive book. And who's the first author so that people can look out for it?
So, well, I mean, the usual suspects. So it's us three, myself, Professor Cavi, and Professor Lobo. We've edited it. There are, I can't remember it's 40 or 50 chapters, mostly written by UK colleagues, dealing with actually everything that we've discussed. So from the physiology to the investigation, to the simple management, to the more complex management, to the associated conditions. So, it was designed, Leslie and I began to discuss it quite some years ago as how would you set up a PoTS service? How would you manage any aspect of a patient's condition? So that's coming out towards the end of October and available on Amazon and no doubt other excellent good bookshops.
And what's the official title? Has it got a final title yet?
I've got it here. It's quite a mouthful. It's a concise and practical guide to management of PoTS and associated conditions. Okay,
so concise, 40 chapters.
47.
47 chapters.
They're short.
That's what my kind of concision. Okay, that's fantastic. Listen, I appreciate your time. Professor Lobo's had to step off in case anyone's wondering why I haven't called him into this last section. It's a topic that I wanted to do an online program on because I think you're doing a great job now at spreading the knowledge in this area, but I think there are a lot of professionals whose understanding of PoTS is very limited. And certainly, I deal with hypertension, I deal with blood pressure a lot, but I felt that my understanding of PoTS was very limited, and I wanted to bring some of your expertise to more people. I think really major cardiovascular conferences should be starting to look at how they can have sections on PoTS that are well publicized, that people can come to. As you say, the multidisciplinary nature of PoTS clinics and PoTS treatment programs is really important. And we need to be encouraging commissioners and nations to look at how they fund these programs. Because certainly in our area, I don't think we have any specialist nurses in this area, when really they could do with some more of that. And I think that sort of a nursing background in this area could be very helpful in delivering on all the different interventions we've described, as well as the expert professorial care and super specialist centres that like King's and Bart's can provide. I'm going to close things off there. Really grateful for your time. I hope people have enjoyed it, and I hope they'll be on Amazon in October. So thanks very much.
Thank you very much indeed.
Cheers. Bye.